The U.S. has 800 cases of measles nationwide as of Friday, and 2 more states identified outbreaks this week. Texas is driving the high numbers, with an outbreak centered in West Texas that started nearly 3 months ago and is up to 597 cases. 2 unvaccinated elementary school-aged children died from measles-related illnesses near the epicenter in Texas, and an adult in New Mexico who was not vaccinated died of a measles-related illness. Other states with active outbreaks, defined as 3 or more cases, include Indiana, Kansas, Michigan, Oklahoma, Ohio, Pennsylvania and New Mexico. The U.S. has more than double the number of measles cases it saw in all of 2024. Measles is caused by a highly contagious virus that's airborne and spreads easily when an infected person breathes, sneezes or coughs. It is preventable through vaccines, and has been considered eliminated from the U.S. since 2000. Health experts fear the virus will take hold in other U.S. communities with low vaccination rates and that the spread could stretch on for a year. In North America, an outbreak in Ontario, Canada has sickened 925 from mid-October through April 16. That's on top of cases in Mexico that the World Health Organization has said are linked to the Texas outbreak. A large outbreak in Chihuahua State has 433 cases as of April 18, according to data from the State Health Ministry. Here's what else you need to know about measles in the U.S. How many measles cases are there in Texas and New Mexico? Texas state health officials said Friday there were 36 new cases of measles since Tuesday, bringing the total to 597 across 25 counties, most of them in West Texas. 4 more Texans were hospitalized, for a total of 62 throughout the outbreak, and Palmer and Potter counties logged their first cases. State health officials estimated about 4% of cases, fewer than 30, are actively infectious. 62% of Texas's cases are in Gaines County, population 22,892, where the virus started spreading in a close-knit, undervaccinated Mennonite community. The county has logged 371 cases since late January, just over 1% of the county's residents. The April 3 death in Texas was an 8-year-old child, according to Health Secretary Robert F. Kennedy, Jr. Health officials in Texas said the child did not have underlying health conditions and died of what the child's doctor described as measles pulmonary failure. An unvaccinated child with no underlying conditions died of measles in Texas in late February, Kennedy said, age 6. New Mexico announced 5 new cases Tuesday, bringing the state's total to 63. 3 more people are in the hospital, for a total of 5 since the outbreak started. Doña Ana County reported its first case. Most of the state's cases are in Lee County. 2 are in Eddy County and 1 in Chaves County. State health officials say the cases are linked to Texas's outbreak based on genetic testing. New Mexico reported its first measles-related death in an adult on